National Coronavirus Command Council has decided to retain South Africa at adjusted level 1 of COVID-19 pandemic lockdown. The council has directed the department to closely monitor the rise in COVID-19 infections, which are now largely driven by the Omicron variant. Omicron is known to be an extremely transmissible variant which has now spread on a global scale. Health experts have warned people to exercise caution and adhere to the COVID safety in measures. But for more on this, we are now joined via Zoom by health activist Dr. Kgosi Letlape. Dr. Litlape, thank you so much for your time this afternoon.
Good afternoon to you and good afternoon to the viewers.
Now, Dr. Litlape, what we do know about this variant is that it's extremely transmissible, as I've said, and not as severe as the other variants like the Delta variant. Do you support then the National Coronavirus Command Council's decision to keep the country under adjusted alert level 1?
Well, it's not about supporting them. It's not an unexpected decision, given the fact that we've crowdfouled when we were put on the red alert by the UK, and we've asked them to keep the borders open. It would not have made sense, having asked that, to close our own mobility inside the country. So I'm not surprised that we've been left at level 1.
Now, you know, we're looking at the Omicron variant, and as data is coming in, a few things are also, you know, coming to the fore. But how concerned should we be that, you know, the narrative now from health officials and some data scientists are pushing the messaging that suggests that the variant is not harsher than the Delta variant? You know, would it cause some level of complacency in people, as the WHO has also, you know, warned against?
We should guard against complacency because this is highly infectious. It passes on very easily. So even though we may be seeing low mortalities now and low numbers in ICU, if the numbers of infected people rises exponentially, even if you have a low percentage of that number in hospital, if the numbers become too great, it will overwhelm the hospital system. So this is no time to be complacent because we do not know what the virus holds for us in the next 2 weeks. So the non-pharmaceutical methods become critically important. Personal decisions become critically important. We still need to avoid gatherings. If we're going to be meeting with people, closed ones, do it outdoors. Sanitize. Wash your hands, have masks on. Physical distancing is important. But critically, I hope families have taken the opportunity to vaccinate. Because one of the things that will protect us as families is if all of us that are eligible for vaccines have taken that opportunity and have vaccinated. Because that's when the severity of disease becomes much less. Your chances of ending up in hospital are much less. When you look at it, more than 80% of the people that are hospitalized are people that are not vaccinated. So the non-pharmaceutical methods and vaccination remain critical. And behavior is still essential, that you not go into gatherings. Because it is highly infectious. You go in there, you will be infected. And those with comorbidities still have a high risk of serious disease.
You know, health experts, Dr. Litlape, have tried, you know, to at various points, you know, to talk about the effects of vaccinating, even for those people with comorbidities. But vaccinations in this country remain extremely low, and we know that that's because of hesitancy and, to a larger extent, anti-vaxxers. What can be attribute this to? I mean, should we as a country take a step back and say maybe there's a lot of misinformation out there? The information that was, you know, originally shared has not landed in the manner that it should, and therefore take a step back and then start the drive again to start educating those people, especially those that have genuine concern around, you know, their existing conditions, illnesses, where they are genuinely afraid to take the vaccine. Because at the moment, I think we are just repeating the importance of taking the vaccine, but there could be a problem there in terms of how the message is being read across the country?
I hope we've learned that we should depoliticize COVID so that we leave it to those that work in the healthcare system and the healthcare professionals. And in a sense, we've underutilized the clinicians that are in the cold face. We have not mobilized our general practitioners to be at the forefront of this fight, because they are the people that would allay the fears of the public. They are the people that treat the communities that the communities trust. And I think we still got a long way to go in terms of mobilizing all the resources at our disposal. We could do much more in utilizing the normal healthcare channels, local clinics, general practitioners, local independent healthcare professionals that the patients see that are able and are licensed and are credentialed to provide injections. Every GP's room should be a vaccination site. Every local clinic should be a vaccination site where the people normally go for their healthcare. And if we mobilize those people, we wouldn't be having the challenges that we have. Hesitancy would be much less. I think part of the problem that we call hesitancy is not going to people that are trusted by society, not empowering them, not enabling them, and saying to the people, go to your local healthcare providers. They will tell you, we are now bringing the vaccines to you. Look at the beauty if your family doctor is empowered. You'd safely go there because you know that if there's any adverse events, you are in good care. We would have a much higher uptake than we have right now. So there's a lot that we can do. All these vaccines that are in storage should be out there. We should be giving booster doses and third doses for Pfizer to everyone that is eligible. We should not be waiting for January with those stocks. So there are things that we can do much better. But the key is to depoliticize the response. Take it to the normal clinicians that the people go to.
Dr. Litlape, you raise a very important point, in terms of educating the healthcare profession, people that are trusted in society, because this is also a concern that the South African Medical Association, also picked up and brought to light, that concerning that some healthcare professionals also, speaking an anti-vaccination kind of language, which further just deepens that sense of hesitancy and anti-vaccination. But Doctor, just to move the conversation forward, we knew as a country that we are going to be at, the fourth wave around about this time, hence the conversations that happened before the local government elections happened. Now, no one was talking about the Omicron variant. So, of course, that accelerated, the country being at the stage that it's at now. Where would you say we are as a country in terms of, just having had taken the priority to make sure that when the fourth wave hits, we are ready? But already we are seeing high numbers, as we've seen in the first and second wave. Yes, we know that this variant is not as serious, but should we have done something more, particularly given the fact that we are still at level 1? People are traveling now, they're allowed to. The livelihoods of this country are still at stake, so tourism is advised. Should we have done something better to prepare for where we are now?
I think we've done as much as we can to prepare society. All of us are fully informed about the benefits of vaccination. All of us are now fully informed about the protective effects of non-pharmaceutical methods, the importance of washing our hands, face masks, physical distancing, avoiding gatherings. That is information that we already have. What we cannot continue to do as citizens is to blame government. The information is there. Where we could have done better, we should be at a stage where we have run out of vaccines, because we do not have enough vaccines to vaccinate everyone that is eligible. That is where we have not done our part. So if you are a South African and you are a family, and you have people in the family that are not vaccinated, and you have tragedies because of COVID, It is something that you chose because the government has made the vaccines available. Even though I've spoken about we could do more, there's absolutely no reason why we still have vaccines that are in storage. Those vaccines belong in arms, not in storage units. So the things where we could have done better are not the issues of government. They are issues of society. They are issues of compliance. They are issues of taking ourselves seriously, protecting ourselves and protecting those around us. We could have done more. We have the knowledge. Why are we not choosing to use it such that we can reduce the effects of COVID-19? Thankfully, we are seeing less severe disease. We're seeing a decreased number of deaths, but that is no reason to be complacent. And I think we should applaud the government for having vaccines available. And we as citizens should look at ourselves and judge ourselves harshly for not having used up the vaccines that were available, that are not sufficient to ensure that all those that are eligible are vaccinated. We should be upwards of 95% on people that are above 50. If you look at the vaccination rates between 12 and 34, they are much, much lower than those that are eligible. That is where we as society has failed.
Dr. Kgosi Letlape, thank you so much for your time this afternoon. We really do appreciate it. Thank you so much.
Thank you.